relationship between theory and practice in nursing. Nursing, like any other science, consists of theory and practice, which are closely intertwined with each other. Nevertheless, it usually happens that theoretical knowledge is difficult to apply in reality, because situations are of a very different nature and are not always provided in advance by the educational process. Therefore, the nurse must have not only good scientific knowledge but also certain skills that will help the professional not to get confused. The first thing that any nurse needs is critical thinking, which allows her to objectively and coldly assess any situation and the patient in particular. The next trait of a professional should be stress tolerance, as any job related to medical care is stressful and constantly challenging. Finally, the third characteristic should be courtesy, as politeness and the ability to find a unique approach to each client are required. There is another important aspect that is connected to the application of nursing knowledge and practice. However, it requires a flexible mindset on the part of the worker. The fact is that situations are not always as simple and obvious as those addressed in training, so one must always gather the most complete information, analyze it, format it, and draw the right conclusions. Otherwise, a negligent attitude can lead to misdiagnosis and other gross professional errors. Summarizing all of the above, we can conclude that practice and theory in nursing are always closely related and dependent on each other, but it is not always obvious. Therefore, due to the complexities of reality, theoretical knowledge alone is not enough to work successfully in this field. The human factor complicates medical practice, and a good professional must be able to adjust to any challenges without panicking and remain competent.